So, our topic today is what is the best filler that's used for nasolabial folds, which are the lines and the shadows that we see between our nose and our mouth, and the marionette lines, which are the shadows that we see between our mouth and they fall down. So as we age, our skin falls south, but it also falls centrally. So these areas here can have just a small shadow, or if those little folds become more grooves, well then hyaluronic acid with Belotero volume is your friend. I'll just get one actually. So the best filler for nasolabial folds with hyaluronic acid is a structure gel like Belotero volume. It's the gold standard. I used 2 of the Belotero products here, Revive for your face, as you know, and Volume to fill out these nasolabial lines and the marionette lines. So if you're thinking of receiving filler for your smile lines, because it creates a shadow here, and these are known as your nasolabial folds, well then listen along. So through the years with smiling, this repeated muscle motion, it eventually causes creases. And even when our muscles are at rest, you can still see the crease, regardless as to what facial expression that we make. So every time we stare into the mirror, or with overhead lighting, which I have here today, and you can actually see the shadows that are cast down on this area here, and I'm 60 years of age, you become increasingly aware of the shadow that these folds, it casts on the lower half of our face. And ultimately you can try to temporarily smooth the appearance of them with Belotero volume. So if you're not quite ready for a facelift yet, as in you don't want to go under the scalpel, but you're happy to go under the needle, well then we can help for sure. These nasolabial folds are very easily injected. We insert the needle here, bring it up as far as the nose, and as we are withdrawing, we will add this structure hyaluronic acid fill here, and then we come down here and we do the same. So that is, sadly, we have 2 sides to our face, so it's usually a mil here and a mil here. So here's a couple of things that you need to know. Okay, right, number 1, because this work is done so quickly, you'd be in and out. This is less than a minute on either side. You'll be in and out so quickly. And do we numb you up? We use a numb cream here. Will you need it? Absolutely not. We also give you an ice pack for you to place onto your area here and here so that you can numb it if you want to. In the Belotero volume, there is numbing agent in the hyaluronic acid structure gel that's in it. So as it's being inserted, you don't feel it. Now, that's not the case with Belotero Revive. You do feel it as it's being injected into your face here. But with Belotero Volume, you don't feel it at all. So that's number 1. Will you need topical anesthetic? We don't always use it because it's done so quickly. But if you're very fearful, we can. Number 2, the injection point that we used may swell slightly. As you're well aware that the common side effects of any aesthetic injection is swelling and bruising. And hyaluronic acid is supposed to attract 1,000 times its weight in water. So it gets to work right away in attracting lots of water to that area here. The hyaluronic acid structure gel that's used in Belotero volume stays where it's put. So it's injected into this spot here. It starts to attract the water. And in 72 hours, you still could be a little bit swollen on this part here. So you need to plan. In fact, once the injection is done, you will like how the result looks. It's surreal that the lines appear so much smoother, having had deep folds for so long. So you'll be so happy. Number 3, what happens the next morning? Well, the hyaluronic acid has 12 or 18 hours to do its work, and that's attracting 1,000 times its weight in water to soften the area and to plump it up. And this will take a couple of days to settle into the interstitial cells and stay where it's put. Now, everybody's experience is different. Some people have a visible plumpness right away in the first 5 to 7 days. And after that, then it gradually settles into the interstitial cells, and you have that noticeable softening of this line here. We can be our own worst critic, and we seem to think that everybody is looking at us, and believe it or not, people are actually more concerned about their own lives than they are in looking at you. So, anybody who knew me, and when I had my nasolabial lines injected, most people said to me that they didn't know it's a thing. Now, you may feel that it's under your skin, because obviously it is. It's injected under your skin. It's not runny honey. It's a bit more of a structured gel. And by virtue of the fact that you see this visible smoothness, yes, you'll feel it under your skin for a while, but eventually it settles into the interstitial cells. And that's something new for you to get used to. It's all a plus. Obviously, you've had something injected under your skin. It's doing what it needs to do. But it becomes part of your new norm after a while. Number 4. You will probably be able to physically feel the structure gel underneath the labial fold. And we have a very conservative approach here. We usually recommend that you start out conservatively with a mil on this side and a mil on this side. Now, if the fold is more of a crease or a groove, well, then we invite you back probably 4 to 6 weeks later in order to have another small amount, maybe half a mil, layered on top of that. It's better to actually go conservatively and invite you back rather than going gung-ho at the first visit and putting in too much. So we don't want you to have a pillow face. We do want to take you conservatively. So you are advised not to touch the treated area, certainly in the first week or so, but after that you'll be massaging it in. Number 5, common question is, how long does the nasolabial filler last? So it lasts 6 to 9 months. Some people, it actually lasts for up to 18 months, depending on how much has been inserted into the area right from the get-go. It does entail that you need to visit us twice per year to have another maintenance dose put in. You may not necessarily need to have a whole mil put in, but you may just have maybe a half mil put in on either side twice a year. So whilst the fillers for the nasolabial folds are long lasting, they don't provide permanent results because we're getting older day by day, and the groove gets older day by day, and Belotero volume can only do so much. But for the most part, 6 to 9. So number 6, when are you expected to come back for your next visit? So it's very dependent on how deep the grooves are and how old you are in years. Obviously, anybody who's in their 30s, they have, very, very small little wrinkle here. 40s, 50s, 60s, they become deeper, and 60s onwards, they become more like deep grooves. So you may not need as much to look maintained ongoingly. But we would expect you to come back to see us twice a year. Remember, we are getting older day by day. It's very gradual. You're not going to suddenly fall off a cliff. You're only getting older a day by a day. You're not going to suddenly turn old if you don't maintain this twice a year. You might decide to come once a year. But thankfully, hyaluronic acid fillers are slow to break down as well, so the effects last for longer. So to wrap up, if you are not ready to go under the surgeon's scalpel just yet, and you are having your targeted facials as we get older, you'll need to have those more often. Sharna does amazing targeted facials next door. That we can help to maintain a lovely smoothness here and to help create a more youthful appearance. So one of the common questions is obviously how much is it, Olive? So it's €450 per mil. So you've got two sides, so that's €900. And are you done in one treatment? No, you're not. We are conservative, so we invite you back 4 to 6 weeks later. You can come back as soon as 2 weeks later if you wanted to have more added if you need it. And depending on your age, that conservative approach may be enough if you're very young. Maybe half a mil on either side might do. If you are that bit older, we usually advise a mil on either side. And depending on your age, you would be invited back for a review anything between 2 and 6 weeks later to have more added, particularly if you have an event coming up. And you don't have to have loads added. You can just have another small amount added. Not everybody needs more, but some people do. And it's not a one and done. All right. If you have any questions in relation to this, please don't hesitate to reach out. We have a free information pack that we can send you by email. All you have to do is reach out to us at the Aesthetic Clinic Clonakilty@gmail.com, and I'll send all the information out to you. All right, I hope that helps.